Morning, everyone. Well, do you know the Trager approach can help you with stress, pain, and other ailments? It can be used with yoga and other modalities. I am Amita from Nourish Talk, a platform for natural and holistic therapies. Presenting this fascinating topic, we have Judith Fasone. She is a nurse educator for over 30 years. She will introduce us how Trager Approach works. Welcome, Judith.
Thank you, Amita. Nice to meet you.
Yes, very much so. And we are excited to see how what exactly is Trager Approach.
Yeah, well, I've been a Trager practitioner for 30 years and nurse, and I found the Trager approach because I really believe in our bodies being able to heal ourselves. And Dr. Trager had developed this approach himself, and he felt that if we could reach the unconscious mind, we could really help the body to learn a new way of being in the world. And one of the things here that is mentioned is that we are re-educating the body. Most people already know how to take care of themselves, but when we have an injury or have been traumatized, whether it's emotionally or physically, the body creates patterns to protect itself. And as we age, that compounds. So there could be many, many things that we have done to compensate for these traumas. And so as a re-educator, I want to initiate new movements and new feelings of peacefulness and relaxation into the body. And so we do have two phases that are explained here in this first slide. And the first one is rather passive, where the person is lying on the table, and I do what in nursing language is known as range of motion. But the person doesn't have to do any helping with that. I just move the body around. I do a lot of rocking and lengthening, and the relaxation response is very palpable for the person on the table. There's another active phase of it, which is either done with a person laying down or standing or sitting in the chair even before they go to the table, where we are watching the movement patterns and we will be suggesting new ways to move. And we call these mentastics. That word came from Dr. Milton Trager and his wife, Emily, and it means mental gymnastics. So the person becomes very conscious of their movements and can then have better control over them and maybe create some new ways to be in their body that's a little easier. Maybe we could go to the next slide. And
Sure. Let's talk about the benefits.
Yeah. So basically, we believe that this approach can be effective for all bodies because it's very gentle and it creates a very relaxed state. So of course, anyone who's suffering from stress, which is really something that we all have in our lives, and it's not going to be we're never going to have a life without stress. Many people have pain, and so we want to help people live pain-free. Stiffness is caused by some of these things that are highlighted here. Also, just in general, aging. I know myself, I turned 65 this year, and I know that in the mornings, some days are very slow to wake up my body, and there's some stiffness in my hands. I play the piano, and I do a lot of backpacking and rowing and swimming, and sometimes I overdo it. So as we get older, our body doesn't recover as quickly. So mornings after we've been laying still, we often wake up stiff as we get older. So you don't have to have a diagnosed condition to get the benefits of the Trager approach. You can really benefit from this just by helping yourself become more aware of your body, become more free and fluid in your movements, which will prevent injuries in the long run. And also will boost your immune system because when you have good circulation, and you have to have good relaxed muscles to have good circulation, your immune system can function better, and it will help you fight things like the COVID virus or anything else, any other bacteria that's in your world that you're not even aware of. So this is an excellent way to strengthen your immune system, to create better circulation and reduce stress and pain and stiffness as well.
Great. So we want to know if there is any research that's done on this approach.
Yes, there has been some. Our lack of research kind of has to do with Dr. Trager himself, who was not a research scientist. He felt like we should only work on one person a day because he got into these sessions so much and he felt the tissue and he marked the changes and he knew that it was really effective work. But he didn't want to study research and put out articles. And that is to the detriment of our approach, because not a lot of people know about this approach. But there have been some people in our community that have done some research on the chronic lung disease one. When we work with a person's rib cage, and you can do this with me right now, everybody, whoever's watching this, and just put your hands up here on your ribs and just notice yourself breathing. And you will feel your rib cage expanding and contracting. And one of the things that happens as you get more relaxed is you begin to have more volume capability up in your ribs. And so even if you have problems with respirations or some kind of a disease process going on, little things that you can do to help yourself open your lungs and have more space in there is going to improve your volume and help you to feel like you're getting more air. And so that was that research. Spinal cord injuries, Dr. Trager felt that unless that spinal cord was severed, the person could regain the movement from that part of the body where the damage was done. He was always approaching this from the point of, we have a network of neural tissue that is endless and can be regenerated. And even in his time, he didn't realize there was not a lot of research about neuroplasticity, which we now know. We can grow new nerve endings and we can grow new neural pathways. 20, 30 years ago when he was around, they didn't even know that. But he felt and saw that it was possible for somebody to regain movement after a stroke or after some kind of a TIA, a trans-ischemial attack, a small stroke in the brain. And so a lot of the research was done around that idea. And then Parkinson's disease, he felt that we really could help a person's total body relax, but you couldn't really reverse the disease per se. People would still have some kind of tremors, but Parkinson's has been looked at a lot with the Trager approach. So there are some articles out there. There was a book that was written by a colleague of mine on a woman who had a mastectomy. And so she did a year-long follow-up with this woman, and it's called 4 Seasons. And so, we look at health very holistically in our community, and it's mind, body, spirit. It isn't just a movement. It's not just, what you're thinking. It's everything all together, and touch is a very important piece of this. I've actually done a case study. It's going to be published in the next few months in Explore magazine. And it's with a patient I'd like to talk about a little bit who had come to me with a lot of pain and multiple surgeries on his spine and hips and very rigid movement. His gait was thrown off, and he had fallen out of a tree when he was 40 years old. He was 60 when I saw him. And all of the complications of falling, 30 feet from a branch. He survived, which was a good thing, but his body over time developed a lot of serious complicating factors. And the most recent was he had his hip operated on, and then within a year, he lost control of his foot. So he had what they call a drop foot. So when you're walking, your foot kind of flops. Are you familiar with that, Amita?
No, not really, actually.
Yeah. Yeah, so I've worked in nursing homes and with elders, done elder care a lot of my nursing career. And this is not that uncommon, but once the foot loses its ability, like if this is my leg, you can't see me, and then my foot just, I can't bring my foot up, so the foot kind of flaps as you walk. There's
Oh
no
my
way
God.
for these muscles to pull the foot up anymore.
So you
So,
can't walk or you would wobbly, right? That's what you're saying?
well, you actually need to wear a brace. Usually they put a brace in the shoe so that it holds your foot flat so that you
Oh,
can't, so it won't drop. And people have a lot of falls because of that. But so I worked with him for 18 sessions and we recorded him walking before and after. I have videotapes of that. But the case study that I presented was the bigger picture. His foot drop did improve, but it was because he was so diligent about going home and doing the exercises and practicing some of the stuff he had learned, which is a part of our approach, is that the more you practice what you're feeling when you're here, the more quickly you're going to regain use of your whole body or improve or whatever it is that your goals are specifically. But after 18 sessions with him, the biggest changes in him were his taking back his life, because he really had become depressed, was really kind of done. He just felt like there was too much pain, too much overwhelming. After the first session, he was able to sleep through the night. Before that, he had reported that he had been sleeping on hardware. That's all he could feel in the back was all the rods they had put in. And so sleeping was really fitful. He would wake and go back to sleep. And he just became more body aware, so that his daily activities allowed him to be in touch with something. When it wasn't feeling good, he would change it and do something else. And for many of my clients, this is a major barrier towards healing. We actually keep injuring or re-injuring ourselves throughout the day because we're not paying attention. We have learned to suppress pain instead of look at it as the message that it is. And so the Trager approach really gives someone greater body awareness. It helps you to slow down and reevaluate your movement patterns in the moment, and gives you sort of a new lease on life. I feel like that I'm healthier than I was 5 years ago or 10 years ago, or even when I was younger. I feel much more healthy and I have more endurance. I'm much more active in my world. I'm a lot happier than I used to be. So the Trager approach is a whole person approach for me. And I think that might come from my holistic nursing background also, but I would say that a majority of the practitioners have this same philosophy.
So you mentioned that how you could use it in conjunction with other modalities like yoga or massage therapy or Reiki. So how does do you design the whole program for a client who would come in, or you would only talk about the Trager approach, or you would also prescribe some of the yoga asanas? Or we just want to understand, is it in conjunction or is it like a standalone modality that you would recommend?
Well, I think each practitioner who is trained may have some of these other modalities that they've already studied or not. Myself, I'm a Reiki practitioner, Reiki 2. I have done yoga in the past. I'm not a practitioner or a teacher. I'm not a massage therapist, so I'm a nurse. So I bring that to my work. I would say that what I've done is kind of combined all of those things into my approach. But Trager was the initial training that I had. Now, what I do think is that because many of us know about these other modalities, the way that I would have a client engage with those modalities is to support them in using them and adding this to whatever they're doing. In fact, I sometimes when I will do a yoga pose here or there, if I have something I need to work on a little bit more, but I will add the Trager approach to that. And sometimes I call it Troga, because it's like Trager and yoga. I can do a pose, but I'm moving through the pose. I'm not just holding a stretch, or,
Yeah.
and if it's the Reiki, the Reiki is energy work, and this work, and it's not hands-on. Reiki is normally not hands-on the body. It's above the body, feeling for energy and transmitting energy. And the Trager approach, I believe, is an energy approach also, but it is hands-on. And so my knowledge of Reiki adds to my knowledge of what I can feel and sense in somebody's body. But if somebody loves Reiki and they come to me and say, do you know anything about that? I might use a little bit of it and let them know when I'm doing it. Another one is Pilates. So I have also been certified in mat Pilates so that I can help people really strengthen their core. And I call it Trilates because when you do Pilates, it's a lot of strength and strength and strength. But what the Trager approach is focused on is the relaxation also. So you have in every muscle the opportunity to contract and relax. And if you're always in contraction, your muscles are going to shorten. And if your muscles shorten, you're going to start having limited range of motion. You might still have full range, but it's going to be limited. So we want to teach people how to release and let that muscle go back to the full length that it has before you strengthen it. So I would say, let's do some Pilates and strengthen your core. But after each set of those, I want you to just totally let go and relax again so that your muscles can lengthen. So that's how I would use it in conjunction with these other things. And I do want to say one thing, that I have had chiropractic care in the past, and I have clients that come to me that love their chiropractor. And I think that the thing about the chiropractic is that you're going to get a better adjustment if your body is relaxed first. And so I recommend getting some kind of a Trager session or a massage or something before you get your adjustment. And it will actually last longer and probably be less of a shock because your body is already warmed up. But when you go cold into a chiropractor and they do their adjusting, it can be kind of shocking to the body. And that's not always that pleasant for people. So I always thought that it would be nice for a new Trager practitioner to kind of work in conjunction with in somebody's office like that. But I never had that opportunity. I did work out of a chiropractor's office for a while, and we had many discussions about it, but it wasn't really that collaborative as I would have wanted it to be. But so yeah, I think we need to be aware of all the alternatives that are available and encourage people. When we were talking a minute before this started about the not using medication so much, because our bodies, if put in the right condition, can heal themselves. If you're eating well, if you have the resources you need for clean water and clean air and good food, organic foods and everything, how to approach your body. Movement is a healing modality, and we do have to get the right kind of movement and the right patterns going in our life that can support and sustain health. And so I think there are many, many modalities out there, and the Trager approach is one that I have found to be very, very beneficial for myself and people that I have worked with.
That makes sense. Even Tai Chi would be also a movement, right? Modality, if you think about it.
Absolutely. And Dr. Trager actually he studied Tai Chi for many, many years. And his wife was the first assistant with one of the early Maharishis that came to the States that promoted meditation. And so this is a very meditative and movement-oriented approach. And for the practitioner, if anybody wants to learn how to do this, I am also an instructor trainee, and I've taught many, many classes, and I tutor new students that are coming through the program. When I give a session, I get a session for myself. So I'm never just helping somebody else. There's always this balance of how in the moment can I let go so that I can transfer this feeling of relaxation to you. It's not me doing something to you. There's a dialogue that goes on, and I'm always asking, how is this feeling for you? I will take a pause and we'll have a little bit of a feedback. What do you notice now? Because, even lifting your arm and putting it down, if you're really with that feeling and that sensation, and then you take a rest, you feel the change that has happened in your body.
Absolutely.
So it's very much a mutual discovery of healing when I'm giving a session. And so students of this practice often are, they're really hooked on the idea that, oh, I've been a massage therapist for 20 years and you're telling me I can take care of myself at the table. It's like a new permission being granted to include ourselves in whatever it is we're doing. And that's not just in service work to others, but even if you're sitting at your desk on the computer all the time, if you could just take 5 minutes to close your eyes and let go of all your tension, when you come back into your work, you're going to be much refreshed and more focused on what you're doing. So.
Absolutely. I was just going to say that Judith would be coming back sometime in the month of August with some instructional where other professionals can learn, even the end users can learn from her. But this is really great. I think a new therapy that you have introduced, at least I did not know about it before I met you. So I think this is really good to learn about other modalities, how they can help without any medication. And the case study that you mentioned is definitely itself a successful outcome that we would love to share with the other with our users as well.
Yeah, I'd love to just forward that to you. And I'm also getting ready to put it up on my website at judyfasone.com. So feel free to share it and pass it forward. Yeah.
We will share it on our website and send the link to everyone. As far as this session, please let us know your feedback. These are educational sessions we bring every week, short, and we bring them with the experts. So please let us know. Our email is care@nourishtalk.com. Before I wind up, anything else you'd like to say, Judith, before I close?
I would just like to say, keep moving.
That is really good. Yeah. Especially in today's day and age when I know California, I'm in California right now and it's shut down again, except for the counties in San Francisco and San Mateo. So, one really wonders what's happening in the world. So movement is critical for all of us.
You don't need a lot of room. You could just take your hands out right now with me and just let your hands relax. So make it happen. Move every day, move every joint every day. That's my advice.
Great. Thank you so much for being with us.